Welcome to a Healthy Living video blog at workoutmaster.com. This is Ruben.
And this is Aram.
Today we're going to talk about back pain again. It's a part 4 of our series. We're going to talk about visceral reflex or viscerosomatic reflex, both of those. Let's take this one apart.
Absolutely. Without getting into very specifics of how these systems function, or this technology that doctors of osteopathy and chiropractors often use with patients with back pain. In a nutshell, what we're trying to demonstrate to you is that oftentimes when people have any type of digestive issue, in particular, this is the most common one, and they can actually involve any or many or all of the organs that are actually involved in digestion, what happens is that those organs and glands become a little out of sequence, they become a little sick, they become a little tired, they become very inflamed. And what they do is that they dump some of their energy, excess energy, into the muscles. Well, those muscles eventually get tired and fatigue as well, and now by process of inflammation, where there is a lot of heat, redness, and tension and pain, refractory will actually inhibit themselves. That means that they will stop working. Once you have a structure that might be unstable due to the lack of action of several muscles, more dysfunction can occur to that joint in particular and cause pain. So it's very important to understand that oftentimes we will have a lot of patients with back pain that the main reason why they're suffering is because they have a really digestive underlying issue that they're not addressing properly.
One of the things can happen, let's say, if you have some problem with the spine, let's say you have a disc herniation, you can have some sort of impingement of the nerve running.
Yep.
So the nerve usually runs to a certain organ.
That's right.
And then the organ can start being a little bit less functional, or some sort of dysfunction happening to the organ. So you guys can see how, let's say, a back problem can affect an organ. And the same thing goes backwards. If anything happens for whatever reason, one of the organs is weak, it can go the other way around and create a back pain. That's basically what we're saying. And the reason we're saying is because sometimes you go through an exercise program and you build a good musculature around and you're still getting some back pain. So it's not that everybody has it, it's just another possibility of back pain.
Right, and in many instances people are very diligent with their exercise programs that we design for them, and pain does not totally go away. That's when you actually have to take a back step and begin to do a little bit of deeper investigation as far as what's going on with them with the digestion. That's why it's so important that when they begin to work with any of our tribe per se, that we actually do all those health appraisal questionnaires, because they're going to be able to open up the doors to a lot of information that otherwise gets lost in the shuffle, and you will not hit the target exactly where you want to aim.
Absolutely. So guys, make sure you at least have in the back of your mind that a possibility that something like this possibly might happen.
It's very common, that's my experience, and unless those issues get addressed, the rehabilitation and the improvement of the patient.
What do you think is a good way to check if somebody has the kind of problem? Something like applied kinesiology?
Well, they can actually consult with an osteopath, and they can check, very easily kinesiology with one of the tools. But at a much lesser level with people, of our caliber, that all we do is personal training and some coaching with nutrition and other things. They just filling out, the health appraisal questionnaire opens up the doors to seeing all the underlying issues by the questions that they're going to be giving you back.
Absolutely. So guys, you can refer to our episode that I already did. It's called Health Appraisal Questionnaire. And you can find that questionnaire there and fill it up, and you'll be on your way. Anything else you want to mention?
I think that pretty much sums it up. It's quite a vast topic. By no means do we try to dispel all the information that's or refer the information about it, because it's totally outside of our scope of practice. But most definitely, you can keep your eyes open for that sort of issue rising to the surface and addressing it, with whoever you are working in conjunction with.
Absolutely. And if you do, then your future looks better already. If you share this episode with your family and friends, then their future looks better too. Thank you very much for watching. Until the next time.